Governor Ron DeSantis hitting back against those who say he was vacationing while COVID cases soared in the state last week.
The governor says he was working every day after the holidays, but also accompanied his wife to breast cancer treatments.
Meantime, the clash between DeSantis and his critics comes as combating COVID is back in the headlines, and demands for COVID tests, well, they're skyrocketing.
CBS 12's Jay O'Brien has the very latest on that, Jay.
Yeah, good evening, guys. The governor's opponents argued he was missing in action last week as the Omicron variant burned through the state and testing sites were overrun. Today, he addressed that publicly for the first time.
At his first news conference in weeks, Governor Ron DeSantis asked about criticism he was absent during the worst so far of the Omicron surge. DeSantis striking back, mentioning President Biden's recent vacation.
I guess I should have been at the beach in Delaware.
Wish y'all a happy new year.
The governor made his first public appearance since before the holidays here last night, a church service in Miami alongside his wife. Democrats accusing DeSantis of being missing in action. The governor's office saying he was never off the clock, working for the past few days and also by his wife's side during a recent breast cancer treatment.
This is something that as a husband, I think that I should be doing.
Meanwhile, with COVID cases climbing, demand for testing is clogging many sites run by county and local governments.
They were not designed to be mega test sites. These are neighborhood testing sites.
DeSantis and State Surgeon General Joseph Ladapo now facing calls to reopen massive state-run testing sites that were recently closed when cases fell. But the Surgeon General flipping the script, saying the state will start to prioritize so-called high-value testing of people who are at high risk from COVID or showing symptoms, but will rethink low-value testing of those low risk or asymptomatic.
We're going to be working to unwind the sort of testing psychology.
The White House strongly against that, telling the Miami Herald testing is a key pillar of combating COVID and leaders should not be undermining it, sparking another COVID collision between Governor DeSantis and President Biden.
Now let's look at the numbers of state-run mass testing sites in Florida compared with other states. New York, for example, recently announced it's opening at least 29 mass testing sites that are run by the state. That's in addition to other sites they have. Texas is asking the Biden administration for 6 federal mass testing sites in parts of that state that are surging with the Omicron variant. In Florida, there are zero mass testing sites that are run by the state. Like we said, they're all run by cities and counties in Florida. Now, the state does support all of those testing sites in those cities, counties, and municipal governments. They give them tests and PPE, and they put a lot of money into the process. But ultimately, here in the Sunshine State, it's up to local governments to keep those test sites running smoothly. And right now, that is proving very challenging.
Well, look, I think if I had $1 for every lockdown politician who decided to escape to Florida over the last 2 years, I'd be a pretty doggone wealthy man, let me tell you. Congress people, mayors, governors, you name it. And it's interesting, though, the reception that, that some of these folks will get in Florida, because I think a lot of Floridians say, wait a minute, you're bashing us because we're not doing your draconian policies, and yet we're the first place you want to flee to basically to be able to enjoy life. And so I'm not surprised to see that continue to happen. I could tell you, there are probably about a half dozen governors who had restrictions on their people and then were spotted at various points in Florida. Some of it's been public, some of it's not been public, but people tell me these things, and so these things are spotted. And so that's just the reality that we're dealing with. I think I'm happy, though, that Florida is a place where people know they can come and they can live like normal people. They can make their own decisions. Fauci, again, he's railing against the restaurants. These poor people have had, they've done very well in Florida because we protected them. But this is not an industry that's easy to do very well in. And he's singling them out as if that is somehow such a huge factor when there's all these other things that you could be pointing to. I just think it's wrong. But people know they can come, they can go get a beer. They're not going to have to show papers. They're not going to have to do anything. And just look at what we're seeing now. How big of a failure have vaccine passports been? Okay, if vaccine passports succeeded, you would not see a lot of the stuff that you're seeing in a lot of states that implemented them. And so all it served to do was discriminate against people based on an individual choice, create a two-tiered society. And yes, they are moving, like I said a couple months ago, they are moving to update that to say, in some parts, they're going to say you need a third shot to be able to do. So those policies have not worked. And I think ultimately, look, people vote with their feet. I always say I'm so happy with our Floridians. I'm not asking for people to come move, because we've got great people. We've got a lot of great stuff going on. I think we're going to do a lot more great stuff. But the fact of the matter is, you know, if you look from July of 2020 to July of 2021, we led the country in where people were wanting to come to. And I think that that's a result of protecting people's freedoms and making sure that we had a state worth living in.
Tonight, challenges from the current COVID spike are impacting healthcare operations, while hospitalizations in Florida are relatively low compared to the summer Delta surge.
Yeah, but at least one South Florida hospital has temporarily closed an important unit. Our Stephanie Valderrama joins us in studio tonight with what that is.
Jim, Liz, in late October, the Florida Hospital Association reported the summer Delta surge was over. And while a winter spike was expected, it's not just the 6 patients that are impacting day-to-day hospital operations.
No babies will be delivered at Holy Cross Health in Fort Lauderdale for a while. Over the weekend, our news partners at the Sun Sentinel confirmed that a number of staff in the labor and delivery unit were out sick, forcing the unit to shut down temporarily. Mary Mayhew, president of the Florida Hospital Association, which oversees 200 hospitals and healthcare systems in the state, says there are several factors at play here.
Is this an unforeseen challenge of the pandemic?
Well, first, we've had a severe workforce shortage that preceded the pandemic, has been exacerbated by the pandemic, and now, as we confront a highly contagious variant, it is absolutely affecting our staff.
Mayhew notes that at the peak of the Delta surge, 17,000 Floridians were in the hospital. As of today, just over 5,400 are hospitalized. The Omicron variant, which is behind the winter spike and has shown it can infect the vaccinated, directly impacts hospitals where staff are already stretched thin. And that presents a different challenge. Last week, the CDC shortened the isolation and quarantine period for healthcare workers, which will ease some of the strain. But hospitals have to make contingency plans in case too many workers have to stay home at once.
Typically, that starts with potentially delaying some of those procedures and services that can be safely postponed in order to redeploy their staff to the hospital, to the bedside.
CBS 12 News reached out to hospitals on the Treasure Coast in Palm Beach County, JFK Main and North Campus, Palms West, Longwood Regional, and St. Lucie Medical, as well as the West Palm Beach VA, have plenty of beds and staff to care for patients at this time, but they are prepared to shift as patient need does change.